I'm Nick Altmeyer, linkinglewiscounty.com, here today with Jesica Nichols. Jesica is the clinical instructor of long term care at Lewis County Health System. So, Jesica, you're here today. Welcome. You're here today to talk about an exciting opportunity you have with your upcoming Certified Nursing Assistant Training Program. So, do you want to tell us a little bit what that's about?
Yeah, so we're super excited at Lewis County General Hospital and Residential Facility that we will be offering a free Certified Nursing Assistance Program. So if you are caring and compassionate and want to get into the healthcare system and start working, we are going to have a free course that you can come and learn skills and get a certification and be able to help take care of our community.
Okay, so the CNAs are kind of like an entry-level position to the healthcare profession?
It's a foot in the door, but it's a very important position.
Mm-hmm.
They are taking care of our residents and our community members, providing that skill and need for our individuals.
Okay, so let's talk a little bit about what the program actually involves. Like, what kind of time commitment are people looking at, and what kind of people are you looking for to join the program?
Okay, so for our program, it is certified through the New York State Department of Health,
Mm-hmm.
and it requires us to have a minimum of 100 hours.
Okay.
However, I understand life happens, so we've built our programs so that we have some little leeway, because kids get sick, individuals get sick, car breaks down. So we've built it to 120 hours, so that way you would be eligible if you were sick to be able to miss 8 hours of clinical or 8 hours of classroom time,
Right.
and still be successful and still continue to be able to graduate and get that certification. The way it's structured is the one in September, the class that we have in September, we're going to be doing it in evenings.
Okay.
Because I understand individuals want to better themselves and want to get the certification and get into the healthcare system,
Right.
but have to work,
Mm-hmm.
So I'm thinking evenings for the first class is appropriate. You work during the day, you get a little bit of I got to get ready, and then head into class. It's not every day of the week. It's anywhere from 2 to 3 days a week.
Okay.
5 hours a night. You would have lecture. We have labs where we go in and work with skills. We work with mannequins. We work with individuals.
Mm-hmm.
And then towards the end of the program, we actually go and do clinicals in the nursing home on the floor with our residents.
Okay.
The clinicals, the way it's structured a little bit, because I want to make sure everybody gets a taste of
Right.
every shift, is we'll do some in the evenings,
Right.
and then we'll do about 3 clinicals in daytime.
Right.
So you can get both feels of it.
Because different things happen on different shifts. So, during the daytime, you're probably doing more feeding and carrying, where at nighttime it's a different sort of thing that you might have to do. So, as far as we mentioned the time commitment and what the program involves, and all of that is done right at the hospital campus here in Lowville, correct?
Yes, right at the hospital. There's a classroom with a lab set up specifically designated for the Certified Nursing Assistance Program.
Okay.
And then when we do our clinicals, it will be right on the nursing home units.
Okay.
So we have 4 floors. Each floor is a little different. So we will be able to work with different populations in our nursing home.
Right. And I know that you mentioned, and this is a really important part, that the class is free.
Yes.
So this is a course that you might see advertised through a college or something like that, where you have to pay to take the course. So I think that you did mention that it's not a paid training, so you don't get a paycheck for your time while you're doing this program. But it is a free program, something that in a lot of cases you would pay to, have to get the certification. And once you have the certification, like you said before, this is, if you have other aspirations in healthcare, this is a great stepping stone to really get your foot in the door and get started in the healthcare services.
Absolutely. To be able to come in and learn these skills, some people just fall in love with it and they don't want to go on to be a nurse or any other thing in the medical field.
Right.
This is their passion. This is their purpose. And we've had people that worked 40 plus years as an aide. But if you're like, oh, I think I like medical field and I want to go see, this is a great paying job. You know, you're not going to get paid for the program, but the program is free. We provide your books, we provide a uniform, those types of things, and it's investment in your time to better yourself.
Right.
Right? And then when you're done, you have a good paying job.
Right.
That's not just a job, it's a career.
Right. And I think you mentioned too, I don't know, I don't think we talked about like class size or whatever, but you're pretty much saying that if you complete the program and get the certification, that you're almost guaranteed a job within the health system?
Anywhere in the health system. If you look around, there's positions available everywhere. And because we're doing our clinicals in our facility, you get to know the residents. You get a leg up.
Right.
That, you know, if you choose to stay with Lewis County Health System and residential facility, you already have a beginning. You already have a basis. You know people. You know different things that we use and what have you. But it's a great opportunity, and you won't be without a job.
Right. And I think that you mentioned that Lewis County Health System is kind of at the top of the heap locally of starting rates for the CNAs. So anywhere from $19, $20 an hour range you can expect to start out at. And then I'm sure, like as with anywhere else, you know, there's grades and steps as you get longevity and achieve certain goals. Maybe you have an opportunity to advance your pay rate as well.
Absolutely. And once you actually become a certified nursing assistant, and we didn't discuss this, there's other opportunities within that. Our facility specifically has our CNAs, and that's rehab certified nursing assistants that work with individuals that need to be walked on, 3 or 4 times a day,
right,
or needs to have splints or some other things, and that person is specially trained.
Right.
We train all of our individuals in dementia care. So that's a skill that you will be able to build upon through working at our facility.
Okay. So let's really drill down on the details of the program again. So I know the deadline to apply for the program is you need applicants to reach out to your office and submit their application, and we'll throw that information up on the screen for people by August 1st. And when exactly is the program starting?
So we're slotted to start the first week of September.
Okay.
Because we need that month buffer because there's requirements that are needed.
Right.
You have to have a physical, you have to have a drug screen, we have to do a background check, and that can take anywhere from 2 to 4 weeks to get done.
Okay.
So that's why we said August 1st, we want the applications.
Right.
We can only accept 8 students because the ratio is 1 instructor to 8 students.
Okay.
So we need those people processed, and the physical, the drug screen, the background check is all done at Lewis County Health System, and that we pay for that. So that's another thing that's not, an added cost. It's free. So that's why we really are pushing for that August 1st, and we have gotten quite a few applicants, and I'm starting to do interviews, and getting people in through the door.
Okay. So based on what we talked about before, you start the first week of September. You're probably looking like by the end of the year, probably like November-ish, you're wrapping up the training program and actually looking to get a job in the field, potentially?
The way the calendar's looking is by October 30th, we should be completed in the Prometrics test, which is provided or given by the New York State Department of Health, which will give you the certification. Like, they're the ones that say, here you go, you're good to go.
Right.
Is October 30th is the last day. So potentially you could be working by October 31st. Okay.
And we did just briefly touch on, but just to let people know, like, what some of the prerequisites are that you're looking for. So, there's no degree required, I think you said.
Correct.
And then you just kind of mentioned the 3 steps that you carry out, excuse me, prior to the application process. The drug test, the drug screening, the background check, and the physical. So physical is basically just to make sure that you're able to perform the physical nature of the job,
Right.
that you're healthy, things like that, able to lift weight and do things like that. And I think you mentioned the background check is standard just because you're dealing with vulnerable population.
Yes, and that's all these, the physical, the background check, and drug screen is what anybody goes through
Right.
to work in a healthcare system.
Right.
So it's not out of the norm.
Right.
And we want to make sure, because we are taking care of our community members and how
Right.
important that is, that we make sure the people that are coming in are appropriate.
Right.
And going to provide the best care possible to our population that we serve.
Right. So, just to wrap things up, like you mentioned, if you're a caring, compassionate person and looking for a way to help the community, and still earn a paycheck, this is probably, this sounds like a really, really good opportunity to get involved in a field that, looking at the long term, it's not one of those industries where you're going to have to worry about, are you going to have a job 2 or 3 or
Right.
5 years down the road. Like this seems like especially here in Lewis County with our aging population, this seems like a skill set that's going to be needed in the foreseeable future.
Yes, it's a very high demand career.
Mhm.
That's needed, and you won't be without a position somewhere.
Right.
Hopefully it's at Lewis County Health System,
Right.
taking care of our community, because that's what makes us special.
Right.
Is that we care for our neighbors, we care for our friends,
Right.
and we provide the best care possible.
Okay, so once again, if you're interested in the program, applications need to be in by August 1st, and you can give Jessica a call at Lewis County Health System. Her number is 315-376-5610, or you can also email hrsd@lcgh.net.
Yes.
And we will also throw that up on the screen one last time. Any closing remarks before we sign off here,
Yeah.
Jessica?
And if you're like, I'm not quite sure, please give us a call. I would love to have a conversation with you and tell you a little bit more, or answer your specific questions that you might have about the program or about the career in general.
Okay, well, we really appreciate your time for stopping in today, and wish you best of luck with this new group of potential employees at the Lewis County Health System. And one last thing just to mention, if you're not able to make this course, the application deadline is August 1st. I think you did mention to me off camera that you try to do these courses a couple times a year, so I'm sure you'll be reaching out when this is coming up again. Maybe in the winter or springtime you might be doing another course.
Absolutely. So
Okay.
if August or September start isn't looking good for you, there will be other opportunity.
Okay, well, thanks, Jessica. We appreciate your time.
Thank you so much.